Another health controversy, this time in KwaZulu-Natal. The department is proposing to remove nurses working in clinics from the first phase of the COVID-19 vaccine distribution list. Last year, South African Municipal Workers Union reporting that several clinics in eThekwini were struggling to cope. Members said that clinics weren't being disinfected and there was a lack of personal protection equipment. eNCA's Thuba Vilane is reporting that story for us this afternoon. What's the reaction then been from the healthcare workers about this exclusion?
Yes, Jeremy, you will remember that in the past few months we've been reporting, especially during the first few months of the COVID-19 in the country, we were reporting the issue of shortage of PPEs in clinics and the influx of people that were coming to seek for medical attention. We understand that now that we are talking about the vaccine that we are expecting to arrive just before the end of the month in the country. The proposal from the Department of Health, the National Department of Health, is that primary health care has been excluded. That talks to clinics as well as your normal GPs. So they're not going to receive the vaccine on the first phase of the vaccine. But we've been walking around, traveling around, and trying to get the reaction from unions, especially those representing healthcare workers. We spoke to Public Servants Association, and they said they believe that this decision will soon be reversed because they don't understand how and whoever that came with this decision, how he was able to come with that decision. They are saying they've conducted their national office to engage the office of the minister to understand the logic behind this decision. But let's listen to Lungisi Ndlovu explaining.
Firstly, in KwaZulu-Natal as PSA, we appreciate the leadership that of KwaZulu-Natal, the MEC and HOD, who have engaged us on the 26th in terms of the rollout. But the challenge that we have, if you look at in terms of these phases, they are saying clinics have been moved to phase 1A, B, and that is going to be problematic because clinics are the first lines of defense. Communities go to clinic, the referrals are done to clinic. So we are saying they must be able to include the clinics in the first rollout. There are so many of our members that have lost our lives in clinics. As we speak, some of them are sick. So it's very problematic. It is for this reason that we have also engaged the National Office of PSA to say they must be able to engage further because you cannot exclude clinic in the first phase. As we speak, people are dying, people are sick. We must be able to develop and get immunity for our healthcare workers that are suffering, under a lot of stress because of this COVID-19.
Lungisi Ndlovu speaks for the Public Servants Association, reporting from Thuba Vilane in Durban.